the most important, he will discuss COVID-19, what we know, what we don't know, and what we got wrong. The brief will share how to analyze, visualize, and operationalize validated information. Thank you, Steve, one more time, and the floor is yours.
Thank you, and good morning, everyone. Thank you, Colonel, for the introduction. I'll get right to the brief here in the few minutes that we have, and I look forward to any questions we have at the end. So as the Colonel mentioned, this is the layout of the presentation this morning. I'd like to talk a little bit about what we do know, so the facts, if you will, of COVID-19 and the coronavirus, what we don't know, some of the information gaps, what we are now starting to understand is either false or fake information or just pure myths regarding the virus, and how we operationalize that and where we go from here. So just for a bit of background and situational awareness, two quotes here, and I've highlighted some sections in red. First, from the UN Secretary General, that facts might be different between different entities. So his statement here again that perhaps we can agree to disagree on some of the details, but my comment back is that there clearly are some facts associated with the virus and our response. And then from Secretary General Stoltenberg as well, that our purpose primarily is to strengthen the resilience of our populations, and we're going to have to be very, very much aware of fake and false information being shared and guard against the hazards of that. So what do we know? First, there is a lot of information, and from the excellent presentations this morning at a national level, we have a good sense of how this virus and our response is played out locally. But as an overview, as of yesterday, there are 4.3 million confirmed cases worldwide. You see the death figure there reported underneath. We know as well that the first cases were identified in Wuhan, China in late 2019. Just anecdotally, I'd like to share that for those of us that were in uniform or are still in uniform, that the World Military Games were held in Wuhan, China in October of 2019 with over 9,000 participants worldwide, 300 countries participating. I'm sorry, 100 countries participating. So for those that like to believe in conspiracy theories, maybe that's something to think about. We also know that the number of new cases worldwide has more or less flattened to around 80,000 cases per day. It's a little bit higher than that, but there's a general flattening of the curve of how many cases, and that gets to two different points. One is there's a general sense that we're underreporting the total number of cases and the number of cases per day for a variety of reasons. And getting to this next point, we know that the virus has symptoms. We're well aware, I think, of some of the basic symptoms of the virus. We also understand that there are many of us that may have the virus but are showing no symptoms at all. And so that impacts the number of cases, of course, reported if I'm not going to the hospital with the virus. We also know that the transmission method is both via direct contact, so touching a surface, but also via airborne means. And I've asterisked that only to suggest that we also know that the seasonal influenza is an airborne virus, but what's different here is there's some sense that this particular virus lingers in the air and can stay long after me, if I have the virus, if I cough, that the virus particles stay in the air. And then finally, we all appreciate that there is yet no vaccine, no cure associated with this virus, and predictions are maybe late fall, as soon as late fall, or into 2021. And not surprisingly, there are major information gaps. As I just suggested, we're not sure when the vaccine will come out. We also are a bit uncertain whether or not we can be reinfected with this virus, and whether those that have been infected that have antibodies, that those antibodies might help others to prevent infection or to lessen the impact of the infection. We've all heard a fair amount about herd immunity. That is, a majority of people getting it, so therefore, and recovering from it, and so therefore being able to go to work, to live normal lives. Again, we're still uncertain about the impact there, and so we're using the best science we can here to understand whether or not herd immunity actually works in this case, as it does in some other diseases and viruses. And then there's a Swedish model. And not to oversimplify, but for those that are familiar, the government of Sweden decided to maintain a general open posture regarding activities. So not closing all public spaces, not closing businesses. They did maintain a very aggressive campaign to protect the elderly and to protect those that have preconditions that were, again, might be in greater danger of contracting the virus. But as the Swedish Prime Minister said, the results are still out. This is a marathon in Sweden as well versus a sprint. And so there are no quick fixes here. So there's still waiting to understand the success of this type of model. And so I'd ask to consider here, as we've looked through what we know and where we are lacking information, what has led us to these figures, what has led us to our understanding so far, and that's validated science. We use an iterative process, and I've highlighted here in terms that at least I understood as a former military officer, that we learn, we train, we exercise, and we evaluate, and then we repeat that process. Right? So we expect science to be imperfect, but we also expect science to get better and provide better information as this evolves. Now, some of the myths and misconceptions include the 4 broad categories that I've identified on the left-hand side of the slide. First is there's a general scientific basis that this virus source was not produced in a lab. However, we've read about, we've come up with a wide variety of news suggesting that this virus source either was created in a lab in Wuhan, so their infectious disease lab is based there. I would say that's part of an information gap. I won't call it completely a myth, but there's still information out that suggests that we just don't know enough information about this at this point. And then the relative danger, early on in particular, but we're still seeing a lot of news reporting that this is no more dangerous than the flu, the average seasonal flu. Why would we shut down our economies when we have the flu anyway? And again, a fairly dangerous misconception when we look at the rate of transmission and the deadliness of this virus. Next is how the virus spreads. So the wide variety of thinking on it and news reporting on it, information sources through social media, how you can get the virus. And as I suggested early on in the slides, there are 2 primary ways: one, direct contact; 2, via airborne, so an aerosol type infection transmission. But nevertheless, those that are looking for ways to reopen economies are looking for every chance they can to say, no, this doesn't spread very. Airborne means rarely very contact. And then notion of cures. And there's been a lot of bad information spread on what actually might prevent or might cure coronavirus, and everything from injecting cleaners into your system to just being out in the sunlight, which I think is a justification for beach holidays and warm climates. My favorite, and unfortunately it turns out to be true, is that alcohol cures the coronavirus, and unfortunately that's just a myth. So where do we go from here? So how do we think about the information that we know is true, where we're lacking information, and that what is purely just made up or myth? And part of what I'd like to get across here is that we have science, but science is only good if we make it relevant. So we want to put that information and data that we have into a context that can be used by both the general public, but also policy and decision makers and military decision makers. And as Secretary Stoltenberg mentioned, that we'll be facing a steady onslaught of fake news, false news, myths associated with the coronavirus. and we have to be ready for that. Science can help. So we're all familiar now, I think, with many of the visualization tools that are out there. And these are designed at a glance to provide decision support. This next two slides are just two quick examples of how we think about information and how it can be used to answer a critical question. This particular slide shows hospital bed capacity and occupation rates in Sierra Leone. This was based on a Ministry of Health urgent request. And so in a quick visualization using data, we can get to that answer. Right? We can provide a decision support product that gets to answering an immediate question. It provides location and context. And again, from our military backgrounds, this gets to that notion of human terrain mapping, right? So we're using geospatial technologies, we're using good, validated information to map something that will help human decision making. These slides as well, again, a quick visualization that when you apply multiple layers of data, you can derive additional information that will be useful for decision makers. So taking statistics and impacts in context. So the slide on the right showing a number of cases in Afghanistan, vulnerable populations, and then at the lower right hand, the comparison. So again, as a decision maker, how am I doing in Afghanistan compared to neighboring countries? Am I at a higher rate? Am I at a lower rate? So at a glance, this information graphic using good data can validate that. The slide on the left, and I can provide that separately for any of the countries involved in this call. As for Bulgaria, it's a planning document just listing healthcare capacities from PDC's risk and vulnerability assessments. So closing in on the end of the brief here. As always, we look for relevance, right? Good data, any information is just that until it helps make a decision or enables a better decision. So a couple of points here I'd like to highlight. One is that we're facing coronavirus now, but no surprise, we operate in a multi-threat environment. So the coronavirus, as pressing as this pandemic is not the only concern we have. So we will likely see an increase in cyber activity. We're already seeing indications, target against NATO, target against our national resources and infrastructure. We should expect to see more. We should expect to see continuing proliferation of false and deceptive information for a variety of political or criminal activities. So not a surprise that we will see more of that, and especially as pressure mounts from Sveto's last presentation, that is, we can't live in a state of emergency for 2 years. That notion alone will drive more false and deceptive information to change policy, to change behaviors. The last note I have here is on personal protective equipment. Do we have enough for our NATO HADR missions, as well as our security missions? Are we in fact ready for 2 years plus of this pandemic? We think of crisis management in the terms of identifying threats, understanding the vulnerabilities. Our relevance is based on how we plan, how we prepare for events, predicting, and then adapting to the unknown. The best plans we have, as we appreciate, generally go out the window when we have a new or a novel event like the coronavirus. But the planning process has gotten us to think through situations and be able to adapt once we get into new situations. With that, I offer up the opportunity for any questions. Glad to follow up if you see my contact information there, as well as PDC's contact information. And to the lower left-hand part of the screen, if useful, to request an account via our decision support tool, the account access is available there. Pending your questions, I'll stop my brief here.
Thank you very much, Steve, for your very good, informative presentation. Actually, we have 1 minute just for one question. I would like to assure you, all our spectators, that We will provide all your questions, very interesting questions actually, to the speakers. They will answer, and to the last panel, we will summarize the information what you need. For the last panel from 1600, please be online to hear the answer of this question. Steve, one very short, actually it's not short, but very interesting question for me, if you would like to answer very shortly. Thank you for waking up. Actually, I'm reading in the middle of the night in order to speak to us today. Would you agree that the vulnerabilities of democratic societies have been furthermore utilized to the advantage of authoritarian states or their non-state proxies and allies? What could we, the military, do in post-pandemic circumstances to strengthen awareness of new vulnerabilities of our societies and to help prepare for the next challenge? This is a long answer, but if you could answer in short, please.
Very good. I understand we have a short amount of time. Colonel, thank you for your question. Unfortunately, you cut in and out a little bit, but looking at the vulnerability of populations to false information, and what can the military, what can we do maybe to counter the narratives that are being put out, both for military reasons, security reasons, but also for the general population. I think part of it is to reinforce that we get to better decisions through good information, and so maybe it's spinning the false information around to ask questions. You know, why is that information right? And then again, turning to trusted sources, and then try to understand how do we convince populations to believe in trusted sources. That's going to be a challenge when every social media actor has a voice, and so we just have we need to have a stronger voice. We need to make sure the information we have is based on reliable data that we can prove and share again and repeat. I hope that helps and answers your question, Colonel.
Definitely it is. If you just stop sharing your screen just to see your face on online. And thank you very much for that great presentation and what you provided and answer. I would like again to repeat that all will try to provide answers of all your questions which we have on our website. And to the last panel from 1600, we will try to summarize the questions. With this, we finished the first panel. I would like again to thank you to all our speakers. We will continue after 2 minutes after technical